and welcome back, everyone. I'm Dr. Farzana Hafizullah. You're joining us for another Health and Happiness podcast. And today I am so excited. I have one of my amazing friends joining me as a guest today. She is an associate professor of family medicine and of osteopathic principles in practice and the director of our international medicine program here at Nova Southeastern University's Kiran Patel College of Osteopathic Medicine, Dr. Jill Wallace Ross. Dr. Wallace Ross, I'm so happy to have you here.
Thank you so much, Dr. Hafizullah. It's a pleasure to be here, my friend. It's always a pleasure to work with you. So thank you so much for inviting me for this opportunity.
Oh, it is an absolute pleasure. I couldn't wait to shine the spotlight on you. You do so many amazing things, besides the fact that, you're an incredible human in every capacity. You just practice medicine in a way that really showcases the creativity and the humanitarian spirit. So I mentioned a couple of the things that you're doing. Those are only a couple of the things that you're doing. But I'd love to focus in on your role in the Osteopathic Principles and Practice Department and what osteopathic manipulative science or osteopathic manipulative medicine means. We'd like to showcase that because it's really incredible. These are your best tools, right?
Yes, my hands and my eyes and my brain. But yes, my hands for sure. Well, thank you so much for that introduction. And again, I'm really happy to be here, especially to talk to you about osteopathic manipulation, what my role is within the department, how I navigate that, and what it means to me and what I think osteopathic manipulation and osteopathic medicine is about. So my role in the department, I'm one of several members that are part of the team. As part of the team, I direct one of the courses in the curriculum. So for the students at AACOM, they are taught within the first 2 years the basic curriculum in osteopathic manipulation. So in the very beginning, we teach them just strictly how to look at people, how to palpate, what you're palpating for, what you're thinking about. And then we progress to more and more topics as we progress. And that curriculum goes through the entire first and second year of medical school. So as a faculty member, I am either providing lectures in those courses, teaching the students in the hands-on laboratory sessions where they are practicing their skills, and course directing one of the courses within the 2-year curriculum. As we're teaching the students, they are learning how to feel the body. They're learning how to feel muscles. They're learning how to feel bones. They're learning what is normal versus what is abnormal, what is considered in proper alignment and what is not proper alignment. And they are taught, well, when you feel something that is not correct, what do you do to treat it? So if you have this tight muscle, what are ways for you to decrease the tension in the muscle? Okay, you can try this, this, or this. And there are a lot of different techniques for each different area of the body, and we go through the entire body with them over the course of the 2 years. In addition to the physical component of touching people, diagnosing, treating, and seeing what the alignment is, we also have this very deep understanding of, this is one of the tenets of our philosophy, that structure and function are integrally related. So an example I like to give for this, what people can understand is, okay, I was doing grocery shopping this weekend over at the big bulk store, and I'm carrying 80 pounds of dog food, and I'm twisting and putting it into my car, and 80 pounds of water, and all that frozen chicken, and all of those heavy items. And the next day you go, wow, my back hurts. So yes, your muscles got tight and your back starts to hurt. But those muscles surround the blood vessels, nerves, and the lymphatic vessels that then go to other areas of your body. So for instance, you have a backache from lifting those boxes, and you're going throughout your day and you're like, I'm a little bit bloated. Mm-hmm. I'm a little bit constipated. I'm not quite feeling right abdominally. Well, because the abdomen is innervated by the nerves that go through those really tight muscles in the low back, yes, low back pain and low back tightness of the muscles can lead to actual dysfunction of your organs. you're not getting the right blood flow, you're not getting the right nerve flow, and your lymphatic system, your immune system is not cleaning things as well. So you lift your heavy stuff, your back hurts, and now you're constipated. Look at that.
People don't always think of the interconnectedness of these systems at all.
No, not at all. So what I think of is when I'm fixing somebody's low back, I'm thinking I'm helping you with your constipation and your GI issues. I'm helping you with your menstrual discomfort. I'm helping you with your prostate issues. I'm helping you with all of these other issues that are related to the innervation of that region. So we understand the connectedness between the alignment of the body and the viscera, the organic function of the body. Manipulation can't cure the disease, but I can certainly help the body to be in the best place possible for it to navigate whatever it's dealing with.
That's phenomenal. And, as you know, I'm allopathically trained. I say that, but I have an osteopath's heart. And I really wish we learn a lot of this in our own curriculum. I think it's something that can be, spread throughout all of the healthcare curricula, globally. So important.
I agree. And I think inherently in your allopathic training, you actually know a lot of this stuff.
Yes.
If you look to see where is the innervation to the thyroid, you should know, then you go, oh, well, maybe that area is bothering them. The heart, for instance, when somebody has palpitations or chest pain, and we're trying to figure out, is this cardiac? Is this GI? In an emergency situation, you're going to do whatever you need to do. You're going to get the EKG, you're going to get the blood work, you're going to do everything you need to do to make sure it's not a heart attack. But an osteopath can also, feel the back.
Yes.
And feel if there's an area in the very top of the back between like T1 and T5 or 6, it is more likely to be cardiac. But if the changes, if the issues, the muscle tension starts a little bit lower, T7, 8, 9, then we would think it is more gastrointestinal. So
Yes.
the ERDO doc who feels the back can go, okay, I don't think it's a cardiac arrest, but I'm going to do everything anyway, just in case. So we can use our diagnostic skills to help us even think about what the differential diagnoses may be and to help us narrow it down. But it's a phenomenal gift to have, to learn how to use your hands in this way, which is not something that you would have at an allopathic school.
That's right. And so for me, being here in a College of Osteopathic Medicine and teaching principles of clinical medicine, when we get to the time now where students need to figure out the osteopathic findings, boy, do I learn a lot. So what you're saying is sort of music to my ears because I'm picking up those pieces, but I have that craving for much more. Because as you said, this is critical evidence to kind of really help you to hone in on your differential diagnoses for a patient, make the right decisions, and then, of course, have a co-created treatment plan with your patient.
Yes, and that is very important, the co-created treatment plan. So I like that you said that because in medicine in general, and specifically in osteopathic medicine, I'm not going to cure somebody. I'm not going to heal them. I'm not going to solve all of their problems. But what we do is we work together towards what their goals are. So I might make recommendations that they don't agree with, and they have agency to make those decisions for themselves, but we talk together. This is what I see as happening. This is what I think I'm going to recommend. What are your thoughts and feelings? For instance, I might think that physical therapy is going to benefit them because they need strengthening and stretching and very specific modalities. But if you are strapped for money, you can't pay the $50 copay for each visit. You don't have the time to leave your job, to not get paid, to go to PT 3 times a week. There are logistic challenges that people truly have in accessing things that may be beneficial for them. So in working with them towards what they can do and what they can't do, we try to figure out ways that they can still have improvement with whatever their limitations and abilities may be.
And that lines up so beautifully with health equity work and, looking at health disparities and how we can bridge those gaps. But as you mentioned, taking that personalized approach, understanding what factors matter, what are priorities, or what's missing, and how can we help and maybe even fill in some of those gaps.
Yeah.
That is the best part of medicine, is being able to individualize it and really help our patients,
I agree. And being that I have a lot of time with my patients and they're laying on the table and it's a fairly vulnerable position for patients, they open up a lot during those times, and it's a great opportunity for me to really understand who they are at their core, not just a list of review of systems and symptomatology and medications. It's about their entire lives. What did you do this past weekend? Where are you going on your next trip? How are the kids? They sound like just simple questions, but those answers mean so much to me in understanding what their life is. If I understand that they're continuing to lift their 60-pound grandchild and they have herniated discs in their low back, I may have a conversation about how do we adapt this so you can still have those loving arms around you, but in a safer format. Can we do this in a sofa? Can we do this on the recliner? Do you have to do the lifting or somebody else can do it for you? So I'm very fortunate to have the ability and the privilege to work with people in this way, because honestly, being a physician, if people don't realize the privilege that it is, that you get such intimate knowledge of people's lives, it's a true privilege every day to hear stories and connect with people and to help them on their journey to feeling better.
That human-to-human connection,
Yes.
nothing can really replace that.
Nope.
Right? No matter how technologically advanced we are, right?
That is
That
correct.
human-to-human connection will continue to persist. It's so important in health and healing and health and
Yes.
happiness.
Yes.
Right?
And I will be fascinated to see if there are any robots out there that can actually do manipulation. We're just trying to get them to run marathons right now.
My gosh, wow.
But
Well,
So I think I have pretty good job security for
Absolutely.
at least until my retirement. So
Oh, you know what? And you touched on so many different of the common issues that we see in private practice or in primary care, back pain, neck pain, cardiac, GI issues. What are your top 5 diagnoses that that people come in to
Sure.
see you with, that we want our audience to know, how important osteopathic
Absolutely.
manipulative medicine is?
that's a great question. So the first few are probably going to be easier. Number 4 and 5 might be a little bit harder, but
Yeah.
definitely low back pain and neck pain are the 2 pain areas that I see most commonly. And I will say that there are very specific reasons for that. The low back pain is 2 reasons. One, people sit for a long period of time and don't stretch, and they have an imbalance between their core strength and their back strength, and it's just imbalanced. Or people who stand on their feet all day long. So either sitting all day or standing all day, neither is really good on the back unless you have good ergonomics. And then the other, regarding the neck, a lot of that is professionally related. So there are certain professions who are very high on the neck and shoulder stress index, and I would say dentistry, dental technician, dental hygienist, anybody working in the mouth, periodontists, all of that. They have very challenging times because their ergonomics are such that they have to hold their shoulders and arms up for hours on end and twist and turn, and the ergonomics of the patient is just very difficult. So neck and low back pain are the top 2. I have a lot of patients who suffer with migraine headaches. So headaches, migraines. And one of the things that I don't think people understand is that, remember when you had kids and they told you there's these little holes called fontanelles on the top and they slowly close and the head fuses? Well, the head never really fully fuses. It doesn't stop moving. So we have these suture lines in our skull for the different bones, the parietals, the temporals, the frontals to all move. And we do cranial manipulation so that we can help the skull move better and for the cerebral spinal fluid to flow better, which improves the the blood flow, the neurologic flow, the lymphatic flow, the CSF flow. It improves everything. So we do quite a bit of cranial manipulation for headache sufferers, migraine, even just tension headache sufferers. Then I would say the next big thing is just an assortment of joint injuries. A lot of shoulders. A lot of people have shoulder injuries, knee injuries, hip injuries. So that's a component. And then I have a smattering of people who just come because they had a problem at one point. It's gone. but they
Yes.
know the benefit and they're like, I just feel better when I come to see
Absolutely.
you. My brain works better, my heart works better, or they have systemic issues. So I have quite a few patients with rheumatoid arthritis, a lot of asthmatic patients, and this is a good one. So with constipation and asthma, we actually have things we can do that impact the autonomic nervous system. So I was talking about constipation earlier with low back pain.
Yes.
So one of the things that we think of frequently is we know the sympathetic innervation goes from T1 to L2, and the parasympathetics are above that, the OA, and then the sacrum. So if we move the sacrum in a specific way, if we stimulate the parasympathetics, stimulate rest and digest, it should help you to go. So there are things we can do to help stimulate for going. And then somebody with asthma. So the sympathetic innervation T1 to T12 or T1 to L2 overlies the 12 ribs. It totally overlies the entire 12 ribs. So there are techniques that we can do with the ribs that stimulate the sympathetics. If you stimulate the sympathetics in the region of T1 to T12, you're going to bronchodilate, thin the secretions from thick to thin, and you're going to allow for more oxygen exchange. So the last thing I do on a patient who's asthmatic, at the end of a treatment, I do this specific rib raising technique to help them open up their airways. So it's fascinating to be able to interact with systemic illness in addition to just, oh, my body hurts. And if they come in with, oh, my body hurts, it's not just my brain doesn't stop there because I am trained in family medicine and boarded in it. My brain goes to what else is happening, what medications are you on, what is the rest of your story. So I'll try to understand all of it in order to help the patient. But it's great when somebody tells me they have like, oh, I'm urinating 3 times at night because my prostate is enlarged. Like, oh, I can help with that.
Yeah, fantastic. And no medication needed, just manipulation.
Correct. And you know what? If they need medication to supplement and I'm doing stuff,
Absolutely.
no problem.
Right. You
You
figure
can
it
still
out on the
take your
journey.
blood pressure medicine, but I
Yeah.
am going to help your kidneys to work a little bit better if I can.
Well, I love that. Oh, my goodness. So many people can be helped just from your knowledge here. And you mentioned, of course, the primary care background that you also
Yes.
have. You pull that into the picture. So are there things that people can do at home
Yes.
that you recommend, for your own body to stay in equilibrium?
That's a really good question. So a lot of my patients say, okay, doc, so you fix me every time I come here. What do I do in the meantime? There's a lot of things that we can do. I think one of the things that people have an underappreciation for, and some people just detest this, is stretching. So I grew up very active and in gymnastics. And when you are young and start in gymnastics, stretching is just a thing you do. And when you don't do it, your body craves it. If you ask any runner who's ever been told to stop, they after a certain amount of time, they're anxious. They can't not run. So that's the same way. So stretching is something that I think is really important. And stretching, when you stretch a part of the body, it should be for at least 20 to 30 seconds. It'll feel good for 5 or 10 or 15, but it's not going to actually be effective unless you hold it for a good 20 to 30 seconds. So some of the things that I recommend, simple things. There are simple neck stretches you can do in any chair. There are simple stretches you can do for the psoas muscles, which get tight when we sit down all day long. So like after you're sitting for a long time, there's a stretch you can do to stretch the psoas muscles to avoid and decrease the back pain.
Fantastic.
There are stretches you can do to decrease tension in your hamstrings, which are the which are the muscles on the back of the leg. So when you have the front of the leg muscles really tight and the back of the leg muscles really tight, they're in a constant battle, tug of war.
Absolutely.
So they're pulling on the pelvis from the front and the back and making the low back really unhappy. So addressing some key muscles and stretching them regularly. When you get up in the morning, getting up from your seat when you go to the restroom or for lunch, before you go to bed at night, while you're preparing dinner in the kitchen, it doesn't matter. If you can spend 30 seconds, a minute, 2 minutes, just doing some simple stretching, those things can really help. In addition to stretching, some patients do need strengthening exercises. If they have a real disruption in one muscle or it's super weak, strengthening it over time may be helpful. If I'm going to give homework, stretches, strengthening exercises, I give one at a time. When I give a lot of instructions, I find that none are followed. So if we can agree on one, okay, I have 3 stretches I'd like you to do. Let's try them all here. You tell me which one you like the best, and let's work on that one. And then we'll see how we go. If I can start with one, I can usually add something later, but I try to start nice and slow. I learned that over time when I used to give 5 exercises and nothing would happen.
So smart, and that lines up nicely with the theme of In the Kitchen with Dr. H and the series, small digestible changes. And, like you said, just small bites that you feel you will be able to sustain over the long term, right?
Right. Most people watch TV.
Yeah.
And most people at this day and age fast forward through the commercials. So commercials are 2 to 3 minutes long, and they're usually about 15 to 30 seconds in length.
Stretch time.
Exactly. So if you can use that 3 minutes instead of fast forwarding, stretch your neck, stretch your hamstrings, stretch your psoas. If you're microwaving food and there's 2-minute timer running down, stretch.
Fabulous.
Like there's lots of ways you can find 30 seconds, 60 seconds in your day if you just think about it in these odd places and not make it a big deal like I have to get my clothes on and go to the gym and make it a whole production. It can be something that is not a production at all.
I absolutely love that. So meet you where you are.
Exactly.
Whatever activity you're doing, you can make sure you weave it in.
Yep.
Is there like a resource or a website for stretching and strengthening that you like to recommend?
That is a good question.
If not, you can tell me later. We'll put it in the description.
You know what? I don't have any websites that I use. I don't typically go to the website because what I use is the lab manuals from the OPP curriculum. Okay. Because within our lab manuals, we actually have stretches. And we teach the students how to articulate those words to somebody else. Instead of saying, just follow me, do what I'm doing, is put your left foot in front of your right. Bend your left knee, lean back with your torso. Like we go step by step. Correct.
Well, if you ever have videos and you want to share that publicly, that will be wonderful. We'll be happy to share it on this forum and elsewhere.
I don't think we have any, but we could do that.
Excellent. Mm-hmm. All right. Well, wonderful.
We could do some self-stretches because that would be, I think that would be beneficial for people to see just a few nice, simple things you can do at home.
Without a doubt.
Yes.
I think, I'll be the first one trying it out.
Perfect. Awesome.
I absolutely love it. Well, then now translating all of this incredible science and medicine to the international medicine and outreach. Wow.
Yes.
Imagine the impact. I could just only imagine how you try to even quantify that. But tell me a little bit more about, because you've been on 14 medical mission trips?
I think so.
Right? If I remember right?
I think so. I think it's 14.
You're like a true NSU shark, like coming here from med school all the way through faculty. So I'd love to hear a little bit more about your experience and how this impacts patients.
So it's fascinating. So outside of the U.S., certain countries know what osteopathy is. And those are none of the places we go for medical outreach. So in Europe, a lot of the very developed countries have osteopathy, France and Germany and Sweden and Denmark. And there's a lot of different places that have osteopathy or osteopathic practitioners. But in the places that we go for international outreach, Ecuador, Dominican Republic, India, Peru, Galapagos, even we've been to Vietnam in the past, there's no osteopathic manipulation. They kind of understand chiropractic. They do understand physical therapy. But what they do understand from us is they tell us they have something that hurts. We do stuff with our hands on their body, and they feel better. Mm-hmm. Now, when we go on international medical outreach, we don't always have manipulation tables or massage tables or examination tables that you and I would have in our offices. So oftentimes, osteopathic manipulation has been done on a teacher's desk with a yoga mat on top and a couple of blankets.
Great, very innovative.
Yes, or on a bench or on another table of some sort or whatever we have available. When we first go to a location, it's a little, on the very first day, there's a few people who who understand they have pains and they want to be treated, but they not quite sure exactly what we do. And it is hard to explain in a foreign language exactly what we do, because I don't think the words really translate into like Gujarati,
Right.
for instance, would be a little difficult to understand some of the concepts because I just don't know if they have the words for it. Even in Spanish, I'm not sure that everything quite translates. So after the first few hours, when the first few people start to walk away going, oh man, it's mucho mejor, it's so much better. Then they tell their friend and their friend and their friend, and then everybody comes.
That's right.
And then when we go back to that same location, day one, everybody's there.
Wow. Yeah.
And the beauty of what we do is, like I said, we can't solve everything. I can't make somebody's arthritic knee non-arthritic. But if I can realign the bones that are out of alignment, then how the knee moves is going to be more in the traditional positioning, and maybe the arthritic component is not going to be smushed as much when they walk. So there are things that we can do to just get better alignment to help them to feel better. And they do. Sometimes we do have to do injections of some sort, and sometimes we do give anti-inflammatory medications or Tylenol.
Sure.
But it's great to see that we're able to at least give some release and relief from their discomforts by doing some manipulation. And we've seen crazy things on our outreach trips. I haven't done any heroic things, but Dr. Wallace certainly has had her fair share of really exciting things that she has done. Most recently, when we were in the Galapagos, there was a dislocated clavicle and a dislocated elbow. And for the elbow, she had, in order to undo the dislocation, you have to get a lot of traction. In order to get a lot of traction, you have to have a lot of weight over a prolonged period of time. And so in order to get the amount of weight that they needed in order to get the traction, they taped a box to the gentleman's hand, to the arm, filled the box with rocks from outside to get the weight to be able to distract so that they could get the bone back into place.
Wow.
So there's lots of stories of like
Incredible.
crazy things. For me, just being able to relax the muscles, fix a vertebrae here or two after a woman had delivered her baby 6 months ago, and to fix these things that have just been there because of the delivery and have her be able to walk away pain-free, that to me is phenomenal. So I haven't had any of those. I've assisted with some of those bigger things, but for me, just the patients don't get touched in general in these countries. They go to doctors, they report not being touched, not being heard, not feeling as cared for in certain ways. And so when we are there, especially doing manipulation, which is so physically intimate, the gratitude is more than just the gratitude of I feel better. It's way deeper than that, because we've given, I guess, they feel more human.
Absolutely.
I think that's what it comes down to. Is I think they just feel seen, and they should. Everybody should.
True
and
mind.
that's
Yeah, I love it.
yeah,
Mind, body, and soul.
exactly.
True holistic
Yes.
care of a patient, of a
Yes.
person, of a human being. That's amazing.
Mm-hmm.
Well, you're incredible, and wow, I can't wait to hear more about the other heroic stories. I know that your team, you guys are pioneers in osteopathic manipulative medicine. I know that you've all written books or chapters or pioneered some of the other pieces, in different ways. And this knowledge needs to be shared with the entire clinical community. So thank you for what you do. Thank you to the whole team, part of this process.
Mm-hmm.
We're beyond grateful. And, let's see if we can continue to share this with the world.
It's wonderful. And osteopathic manipulation as a specialty is something you can do anywhere with just yourself. You just have to show up. And I don't need any special equipment. I can do this on the floor, on a table, on a bed, sitting in a chair. I don't need anything special to do it, just my knowledge and my hands with me. And it's, I wanted to come to DO school to have this tool. I wanted to be able to do more. I wanted to have this as an option in my toolkit. And so for me to have this, to do this as my primary role, my primary job, to teach manipulation, to do research on manipulation, to do it on medical outreach, and to have it be such an integral part of just who I am is just a privilege. So I'm glad that I'm privileged to have come here to NSU as a student and to learn these great things and to then carry it forward to the rest of the world and out there in the community.
And we're sharing it with the world.
Absolutely.
So for everybody out there, we got some amazing insight from Dr. Wallace Ross today, not only on osteopathic manipulative medicine and just the science behind what she does and how integrally connected our organ systems are, but how that impacts our international communities, health-wise, just human-to-human connection. So I want to thank you so much for coming and sharing the story with me. I'm just feeling so privileged and excited to share this with the rest of the community. And you've got to come back.
I will come back.
Other episodes.
I will come back.
Perhaps we'll do a stretching and a strengthening.
Yes, we can do.
Right?
Yes, and we can we can be in our exercise gear.
Exactly.
And we can do some stretches and exercising. And I'd be happy to. I would love to show some stretches and some strengthening exercises that are really super easy. You don't need any special equipment to do. Just a chair or a bed, which you already have at home.
Yes.
There's nothing that you need. So I'm more than happy. Thank you so much for inviting me here and allowing me to share a bit of my story and my journey. And I'm excited for what happens next, but thank you so much.
You are very welcome. It's an honor, privilege, and a pleasure as always. And please, while you're watching this, stretch, do some strengthening exercises, right? We'll make sure that we're all healthy and happy. Well, I want you to join me again for another episode soon for Health and Happiness. I'm Dr. Farzana Hafizullah. See you soon. If you're viewing this QR code on your phone, an easy way to access the link is to take a screenshot of it and then long press the QR code from the screenshot picture. Your phone should recognize it and take you straight to the video.